Hello, my name is Ashley Wilson and I'm a registered nurse and also a student at SUNY Plattsburgh. I'm here today to address the need for mandated staffing ratios in all acute care settings in New York State. Patient falls, mortality, medication errors, and other adverse events have occurred when minimum staffing ratios are not in place. In every state except California, there are no mandated staffing ratios that secure patient safety and quality of care. There's an imbalance between the allocation of nursing resources and also meeting patient needs. The need for mandated staffing ratios will secure patient safety, satisfaction, and quality of care that's delivered. Mandated ratios for nurses will also support career satisfaction, retention, and the financial costs of nurses. It's been proven that nurses who are satisfied with their work generally provide higher quality of care and also more cost-effective care as well. In the Safe Staffing for Quality Care Act, also known as Bill 900921 of New York State, is currently pending within the New York State Assembly. The propositions within this bill include the implementation of specific nurse-to-patient ratios within acute care settings. Also, there will be a mandated public disclosure of staffing ratios made available to individuals within the New York State. Also, hospitals will be required to submit annual staffing plans to New York State for review. Finally, the right for nurses to refuse their staff assignments if it exceeds his or her abilities or if minimum staffing ratios are not in place are also included within this bill. Currently, the Safe Staffing for Quality Care Act is currently pending within the New York State Assembly. The benefits of mandated staffing ratios for nurses include enhancing working conditions in nursing facilities. The quality and safety for nurses to provide safe and effective care for their patients will generally improve. There will also be an elimination of intolerable workloads for nurses in the care of their patients. Mandated staffing ratios will outline specific unit-based nurse-to-patient ratios to be implemented. There will be an increase in career satisfaction and job retention rates for nurses, as well as a decline in burnout rates for nurses as well. Nurses in California who do have mandated staffing ratios in place have reported an increase in job satisfaction and job retention, and also the amount of nurses who remain in the workforce. Lastly, there will be a right for nurses to refuse their shift assignments if it exceeds their abilities or if minimum staffing ratios are not in place, which upholds the safety and quality of care that will be delivered. The benefits of staffing ratios for patients include enhancing the quality of care that they receive. Patient needs will be met by instituting more nurses that are available to them. The need for more RNs in a direct care environment is required due to the rising acuity and complexity of patient care and the decreased length of stay. Increase in patient quality outcomes and satisfaction will also occur due to mandated staffing ratios. The higher workload of nurses has been associated with an increase in infection rates and failure to rescue. The increase in patient safety will also occur due to minimum staffing ratios that are in place. Improving RN ratios will improve the occurrence of adverse events and the number of medical errors. Lastly, mandated staffing ratios will reduce readmission rates and also improve consistency of care. The probability for readmission is reduced when nursing workloads are also reduced and work environments are bettered. The professional support for mandated ratios includes the New York State Nurses Association. The New York Nurses Association has been a supporter of this bill for over 8 years. For the Quality Care and Safety Act, the New York State Nurses Association respects the obligation of nurses to ensure adequate staffing levels to ensure quality and safety of care. Safe staffing will uphold the integrity of nurses and their responsibility in ensuring quality of care for their patients. The support of the New York Nurses Association also holds the position that nurse staffing ratios will lower mortality rates, better nursing outcomes, and increase nurse retention. Patients and nurses will both benefit from such legislation. The opposition to mandated staffing ratios has been addressed by the Greater New York Hospital Association. This organization believes that mandated ratios undermine the hospital's ability to make their own decisions regarding staffing needs. Staffing ratios also do not take into account patient acuity and the experience of the nurse, as said by the Greater New York Hospital Association. They also say that there is no evidence that staffing ratios will guarantee the delivery of quality of care. Lastly, the Greater New York Hospital Association holds the position that public reporting of staffing ratios is not meaningful information. They believe that this sense of reporting does not incorporate specific variables into their reports. In rebuttal to these statements, staffing levels do take into account patient acuity and severity of illness. The differences in specific nurse-to-patient ratios on different nursing units reflects the acuity of illness and the population of patients being cared for. The predisposed staffing ratios directly influence the quality of care delivered. Ensuring quality of care and optimal patient outcomes are predisposed by working conditions and psychological factors such as fatigue and burnout. Lower staffing levels heighten the risk of poor patient outcomes, occupational health issues, and also psychological states and experiences such as burnout and fatigue. Lastly, public reports on safe staffing are meaningful and are specific. There are measurable quality outcomes secured by the National Quality Forum that are made available and measure the quality of care that's provided to patients. Public disclosure will incorporate the standardized set of quality measurements into their reports, which include whether healthcare services provided are safe, timely, effective, beneficial, equitable, and efficient. Lastly, nurse-sensitive performance measures are examined in these reports, which also compare staffing ratios. In conclusion, safe staffing is very much needed, and the legislation for the Safe Staffing for Quality Care Act needs to be passed. The Safe Staffing for Quality Care Act will help to improve patient outcomes by enabling a safer working environment for nurses. The rising acuity and complexity of care will be addressed and acted upon by establishing safe staffing ratios for nurses, which strongly enhance patient outcomes. Specific nurse-to-patient ratios will secure optimal working environments that support quality, safety, and the professional performance of nurses. More experienced nurses will remain in the workforce, and the rates of nursing leaving the workforce will decline. Nurse retention and job satisfaction will both improve. The financial costs of nursing facilities will also be enhanced by taking measures that prevent adverse occurrences. Lastly, the continuity of care will be improved by enabling the consistency of nursing care and keeping nurses where they should be. Professional organizations such as the New York State Nurses Association have backed this bill for many years. Please support the mandated staffing ratios for New York State and pass the Safe Staffing for Quality Care Act. Thank you.